6 things you need to know before you go for your hair transplantation. Hair transplantation is a well accepted surgery nowadays. Everybody who lose the hair and get baldness, they know that hair transplantation is a treatment for them. I need to emphasize over here, hair transplantation is not only for men, it is for female pattern baldness also. First thing, know which type of surgery you are going for. There are 2 types of hair transplantation surgeries. One is FUT, other is FUE. FUT is follicular unit transplantation, where you remove a finger width strip of the skin from back of your scalp. We stitch that area there, and this strip is taken out. Each hair follicle from that strip of the skin is separated, and those follicles are transplanted in the recipient area or frontal area. FUE, where you remove a single hair follicle from the scalp and you transplant. This is a stitchless surgery. Secondly, so which is better? Though follicular unit extraction is most popular technique nowadays, you will require a combination of this FUE as well as a strip technique when you have poor donor area. Means you have the less donor area on the back, you have more baldness to be covered. That time only stitchless method cannot give you those many hair follicles. You need to add with the FUT. Secondly, how many grafts one can place in one surgery? Previously, the hair transplantation used to be very tedious thing, and the maximum hair grafts can be transplanted in a day used to be 1000 to 1500. But now with a finer technique and experienced hands, one can remove 3 to 5000 or up to 6000 hair grafts in a day. And the people are touting that as a mega session and super mega session. But all the international senior hair transplant surgeons, they believe that the 3000 is a safe limit of transplantation in a single day. If somebody want to transplant more than 3000, it has to be done in 2 different days. The reason is twofold. One, the normal level of human fatigue is up to 3000 grafts, and after the 3000 the quality goes down. Another thing is, even the best surgeon in the world, they don't claim they have the 100% of the result. Means even at the best surgeon hand, with a very well done surgery, there are cases of unexplained no growth or poor growth. In spite of good surgery, you don't have hair growth. If that happens to your case when you did the 8000 grafts in a day, so it is not to put all the hair graft at stake in one surgery. If at all you want more number of grafts, do it on a different day, in a different surgery, after a couple of months or after a couple of years also. Now, how should be the hairline? Nowadays, the many hair transplant clinic, they follow or try to fulfill the patient's wish. Patient want the hair line as low as on the forehead, and they cater to. This is a very dangerous trend. In Skin City, we believe in the concept of futuristic hairline. What's futuristic hairline? One need to know the family hairline. Okay. What is futuristic hairline? Many a time the patient is nostalgic about how he is looking in his school and the college days, and they insist to recreate that hairline of how they were looking in the school days or college days. But in Skin City we ask, what is the father's hairline? What is the uncle's hairline? What is the maternal uncle's hairline? The fact is, the patient is going to attain the family hairline sooner or later. There are patients who match their father's hairline in the next 5 years. One need to design a hairline which should be relevant even when the patient loses all the hair. So, a hairline has to be less aggressive and should stand relevant even after the 10 year, even after the 20 year, even after the 40 year of the hair transplantation. Even the patient doesn't go for a second hair transplantation, your hairline has to be relevant throughout the life. This is called as the futuristic hairline. So, not going by the patient's demand or patient's pressure, the surgeon has to independently design what the hairline will suit his face over the next 30 or 40 years. Then this brings to the next important fourth point, that is age. What age somebody should go for hair transplantation? In Skin City, we discourage the hair transplantation below the age of 25 years. Reasons are twofold. Before 25 years, the hairline is not mature and the patient is not mature. Hairline at before 25 years, the hairline is just started receding and it is not matched to its family hairline of the baldness, and there the hair transplantation done today can be irrelevant after 5 years. And secondly, before 25 years, the patients are very desperate, they insist for a low hairline and that makes that hairline irrelevant in the future. So we always manage the patients before 25 years with non-surgical techniques like the medicine, mesotherapy and PRP, and hair transplantation is suggested only after the age of 25. Then who is doing the surgery? If you decide to choose a hair transplantation center, see who is your surgeon, how senior he is, where he is trained and what is his philosophy. If somebody accepting every case, he may not be a good surgeon. In hair transplantation, by rule of thumb, a good surgeon reject more cases than accept it. So, a surgeon who believes in futuristic hairline, who reject more cases, who gives objective advice, he will do the hair transplantation only when necessary. Don't believe in somebody, assistant who is convincing you on the phone for hair transplantation and you directly go on the table for a surgery. No, see your surgeon before you go for a surgery. Lastly, what is the setup of hair transplantation surgery? You need to see the setup where you are going to be operated. Nowadays, after the invention of the stitchless hair transplantation, the hair transplant has become simple. Though it is simple, it is still a surgery and you require operation theatre backup. So you need to have a medical backup, you need to have anesthesia backup, you need to have emergency backup if something goes wrong, and you need to have a big enough center which can have all this backup in case of a rare emergency. So hair transplantation, once it was a big surgery requiring a cut, stitches and a surgeon, but now it is simplified to a stitchless surgery, but it is not that simplified to be done in a mall, in a spa, in a salon or in a parlor. It's a surgery, so you please see that you are getting operated in a surgical setup with a good surgeon with an experienced surgical hand. Thank you.